Today, we want to talk about an important health topic, sleep apnea, and an interesting way it can be treated that's not the traditional noisy machine that you often think about. Joining us is Dr. Erica Johannes of Dental Sleep Doc. Thanks so much for being with us.
Thanks for having me.
So tell us what sleep apnea is for those who may not know.
Sleep apnea is when the airway, the part of the airway that's behind the tongue, either closes fully or partially closes while we're sleeping. The biggest signs of that are snoring and waking up tired or being tired throughout the day. Every time the airway closes, the oxygen drops and then the heart rate spikes. And so that's happening all night long. And it's really hard on the body, which is why sleep apnea is related to high blood pressure and type 2 diabetes and heart attacks and strokes and Alzheimer's. And that's just a few of them.
Wow, so it can be a very concerning health condition.
Absolutely.
So why are you so passionate about treating sleep apnea as a dentist?
So 10 years ago, my children, who were really little at the time, were diagnosed with sleep apnea. And having them treated was life-changing for them and for me as their mom. But then I dove into studying it and learned that just about everybody in my family had sleep apnea. And I've been able to either treat them or get them treated throughout the years. And so it is really personal to me, and that's why I'm so passionate about it.
So tell us a little bit about your background as well in just general dentistry. How long were you practicing that?
So I like to say I was a real dentist, for about 12 years doing general dentistry until I found sleep apnea and the connection, and I really fell in love with it.
How is sleep apnea treated? I know there are several different ways.
Right. So the most common way that we know about is a CPAP machine. And any treatment is focused on keeping the airway open. Since sleep apnea is the airway closing, we want to keep the airway open. So CPAP machine, most people have heard of, is a little mask that goes over the nose or just the lower face, and it blows air up the nose, down the back of the throat to blow the airway open. Mm-hmm. There are surgical options for treating it, and then there is another common and non-invasive way, and those are oral appliances, also called mandibular advancement devices.
Interesting, and you did bring some examples with you, so I want to take a look at these, and if you would just tell us how they work, because I have never seen anything quite like this.
Yeah. So there are 150 probably different kinds of oral appliances, but they all do the same thing. They go on the top teeth and the bottom teeth, and then those two pieces are connected to hold that bottom jaw forward. So where CPAP blows the airway open, a device like this is moving the jaw forward to physically open the airway.
Wow, and does that have any effect on the jaw? You know, during the day, would your jaw stay forward or does it go right back?
No, it goes back. We do stretching exercises. Being seen by a dentist who knows what they're doing is really important to avoid any potential side effects.
So who are the best candidates for these specific appliances, any of the 150 of them?
Yeah, there is no one size fits all. So the best candidates are someone with mild or moderate sleep apnea, or someone who has tried CPAP and not been able to tolerate it, or just doesn't want to do that. The requirements I set for patients are they have to have teeth, yeah. They have to have stable teeth, and be able to move their jaw.
Yeah, and with your experience in general dentistry, you can definitely assess if someone has stable teeth.
Absolutely.
Of course, that is very important. And does insurance cover these appliances?
Yes, they do. So
wow.
These appliances are covered by medical insurance.
Okay.
Which is usually way better for people that way. They're covered the same way that a CPAP machine would be.
Interesting. So definitely a great option for people if they're looking for a non-invasive way. Like you said, if maybe CPAP doesn't work for them or they just don't want to do that, don't want to maybe bother their partner too much. Right. For someone that thinks they might have sleep apnea but haven't been tested yet, how do they go about starting that process?
That is a great conversation for someone to have with their primary care doctor,
okay.
Who can then refer them to a sleep specialist for a sleep study. At my office, we also do screenings for some people who don't have a regular doctor or are just concerned. We do screenings and then send them out to sleep doctors that way.
Okay, and you mentioned some of the symptoms earlier. If we could just go through those again. If someone thinks, maybe I have sleep apnea, what signs should they be looking for?
So snoring is the biggest one, but not every person with sleep apnea snores. So
okay.
That's not the only sign.
Okay.
So snoring, waking up tired, feeling tired throughout the day, like I just could sleep all day and still be tired, that's a big sign. Mm-hmm. But then related to all the other conditions I talked about, high blood pressure, all of those red flags going along with snoring, that's red flags that we need to evaluate it.
A lot of connections to be made there.
Right.
And if someone is looking for more information on sleep apnea, You do have a book available.
I do. It's generally available in my office, but
Yeah.
anybody can go to my website, which is dentalsleepdoc.com. And somebody who wants to know if they're a candidate for this, they can fill out the short little questionnaire to be contacted for a consultation. There they can learn more about oral appliances, and they can also download a chapter of my book.
Wonderful. Well, thank you so much for sharing all of this amazing information with us. It's great to know that there are options for people.
Absolutely.
Is there anything else you would like to share with people about sleep apnea or about what you do?
I like to say that sleep is the driver to our bus. And if the driver's drunk, it's not going to be a good ride. Getting, sleep evaluated and getting great sleep is so important to our health overall.
Definitely. Thank you so much.